we just wanted to go over our recommendations for using a Waterpik for our office. We recommend that you purchase the Waterpik brand, and the type that we would like you to purchase is the water flosser. The reason that we want you to purchase this water flosser is because it comes with a very specific tip, and we really want you to use this one particular tip. It looks just like this. It's soft and flexible and white at the end. Now, when you open this up, there are 8 different tips, and there is another one that is white, but it's more like a brush. And this isn't the tip that we want you to use. We want you to make sure you're using this nice flexible tip here. When you pull your Waterpik out of the box, couple of tips for you. You want to use warmer water in this, not freezing cold water, especially if you have sensitive teeth, because your teeth can be very sensitive to the cold. When you get this tip out, what you want to do is you want to pop it into the holder just like that. Because this tip is teeny tiny, you want to make sure that you are using it between the 2 and the 4 setting. If you use it at a higher setting, when you shoot it in your mouth, it's going to make a mess of your bathroom for sure. So down somewhere between the 2 and the 4 setting. You'll go ahead and turn the power on, and then it has a floss setting and a massage setting, and it's controlled by this button here. We would like you to leave it on the floss setting. We don't need you to use the massage setting at all. A couple of tips when you're using your Waterpik. One of the things that make it really easy for you is to hold it like a pencil. When you turn this on, you want to make sure that it's already going to be in your mouth, which sounds like no duh, but we have a lot of patients that make a mess the first time they use this, actually the first few times, because there is a little bit of a learning curve. But when you're using your Waterpik, the easiest way to hold it is to hold it like a pencil. Because we all write, your hand will just be much easier to use if you're holding it just like a pencil. When you're using the Waterpik, a lot of people think Waterpiks are intended to just squirt in between your teeth. This really isn't effective at all. You could put water in your mouth and swish in between your teeth and do the same thing. The reason that this particular tip and the Waterpik is really effective is we want the water to get down underneath the gum to flush the bacteria out. So when you're using it, like I said, hold it like a pencil. You're going to want to aim that tip at a 45-degree angle between the tooth and the gum. That way when the water's coming out, it's shooting down underneath the gum and flushing that floating bacteria out. When you're using it, you want to move it tooth by tooth by tooth. So just like this, that tip is very flexible, so it's nice and easy to move. The one thing that I do want you to do, when you get in the middle of 2 teeth, I want you to pause. Really let that water flush that bacteria out for you. And if you always want to do the outside, and then you'll want to go back in and make sure you're doing the inside, because each tooth needs to be done on the outside and on the inside. So again, 45-degree angle, down into the gum. You don't need to push real hard. The tip is very small, and because it's flexible, it should not be bothering you at all. Like I said, make sure you're using the warm water in here. And then if we have gone over this with you, we have some of our patients making their own kind of antibacterial, antiviral solution at home. It is just like pool water that you swim in. If we've gone over this with you, we probably gave you our little instruction sheet that is in here. And if you are using this solution, you use the Waterpik the exact same way. Warm water, everything exactly the same. Use the solution in it, but make sure when you're done with that solution that you're flushing your Waterpik out with just straight water, because you just don't want it to ruin the gaskets that are in the Waterpik. And if you have any questions at all, don't hesitate to call the office. We will answer any questions we can for you. With all that being said about the benefits of the Waterpik and what you can do with the Waterpik, we really need you to remember that the Waterpik does not replace flossing. Even though it's called a water flosser, it doesn't remove the plaque that is actually stuck to the tooth. I said earlier, it flushes the plaque and the bacteria and the virus and fungus, all of that stuff from underneath your gums that's floating around, but it doesn't remove the stuff that's actually attached to the tooth. So it doesn't replace flossing. Remember, when you're flossing, what you're doing is you're actually scraping the side of the tooth and you're removing the plaque that grows and attaches to the tooth. So please don't think that just because you're now using a Waterpik that you don't have to floss, because we do see a lot of patients who run into some problems when they do that.